Hello, everyone. We want to thank everyone for being able to participate in our virtual provider panel session as part of Georgia State University's Georgia State University's Prevention Research Center, Connecting Behavioral Science to COVID-19 Vaccine Demand Supplemental Grant, which is part of CDC's Vaccine Confidence Network. My name is Suad Ali, and I am a graduate research assistant. I would like to advise everyone to please make sure you are muted. We are looking forward to hearing from our speakers, and we specifically want to hear from you, our participants. Your questions, ideas, suggestions, and any resources you would like to share. We want to give everyone an opportunity to ask questions, so please use the chat box in Zoom. The session is being recorded if you haven't received the notification yet, and we will be available, and this whole webinar will be available through our YouTube channel. So today we want to focus on COVID-19 and vaccine for adults and children 5 years and up. And let me quickly share with you. Just wanted to give you a little bit of an intro as to who we are and exactly what we do. Perfect. So Georgia State University's Prevention Research Center has 5 COVID-19 community ambassadors who promote vaccine uptake among Clarkston residents via listening sessions, peer outreach, targeted campaigns, support for community organizations, and school outreach. And if any of our trusted community influencers or leaders are here today, we would love to help out at your events in Clarkston. So please feel free to contact us at the email listed below. So it is a great honor to welcome our speakers, Dr. Frank Minja and Dawood Azeemy, for being here with us today. So to begin, Dr. Minja, if you would like to go ahead and introduce yourself to everyone, please.
Thanks so much, Swad, for the opportunity to share today. My name is Dr. Frank Minja. I'm actually a radiologist based at Emory University, originally from Tanzania, and have been quite involved in helping to translate some of this COVID information, especially to Tanzania and Swahili-speaking communities. So if you guys have any questions, no question is too small. We've been talking about this since March of 2020. Unfortunately, we still need to keep talking about it so we can keep our communities safe. So I look forward to sharing some of our knowledge, but also really answer any questions that you may have. So thank you so much.
Thank you. And Dawood, would you like to introduce yourself as well?
Thank you very much, Swat, for the introduction. Hello, assalamu alaikum, and good afternoon to everyone. My name is Dawood Azeemy. I hold an MD degree, a medical doctor degree, and I was working as a physician in my home country, Afghanistan, in the last 7 years. At the moment, I am pursuing a master's degree at Georgia State University. Meanwhile, I am working as a graduate research assistant with Prevention Research Center of Georgia State University. I am very happy to be with all of you today in here and would love to answer your questions regarding COVID.
Thank you so much. And I really appreciate you guys being here today on a beautiful Saturday afternoon. And if I can please just emphasize, if everyone can please mute yourself so we can begin. So the questions we will be answering today are questions that are often asked within the community, and we want to be able to address some of those questions and concerns as well. So diving right into it, we want to begin with Omicron. I think a lot of people don't quite understand what the difference is between Omicron and the Delta variant, and why do we have different variants that emerge every time. So Dr. Minja, would you like to answer that, please?
Sure. Yes, thank you so much, Suad, for that question. So the Omicron is one of the newest variants for this coronavirus. And as we have seen, since the pandemic started, we've gone through like many variations of the virus. And the issue is that whenever the virus is trying to replicate itself or reproduce itself, it tends to make mistakes. And those mistakes are known as mutations. And so those mutations are really what result in the ability to become another variant. So basically, when it results in these mistakes or mutations, the virus begins to have different behaviors. And the two behaviors that we're really interested in is one, how quickly can it spread? That's issues of transmissibility, and how serious of an illness does it cause in human beings, and that's cause severity. So with the Omicron variant, what we know that it's been way more transmissible, so it's been able to move in the US population and many other populations very, very quickly. But we're thankful that it hasn't caused as severe of an illness as we saw in the Delta variant. And so we know that with these viruses or any other viruses, we will continue to have new variants as time kind of goes on. And that's really what speaks to the session today, that the best way to protect ourselves is to get vaccinated, because we don't know what the next variant is going to be. And so far, the most important tool to protect ourselves has been the vaccines.
Okay, very good. And my next question too would be, what are the symptoms of Omicron? Because they seem to sort of replicate the same symptoms for the cold and the flu. And when would you suggest that somebody gets tested for it? And Dawood, if you'd like to answer that, please.
Thank you very much, Swat, for your question. As Dr. Frank explained, that since the beginning of this pandemic, we have seen different variants of the virus. With all these variants, the signs and symptoms of the disease or illness have been the same, with slight differences. So now that we are leaving, we are going through the flu season as well, the signs and symptoms of the flu or influenza virus is also very similar to that of the coronavirus. It is very difficult to differentiate between the two, but we know that the influenza virus or the flu virus will last for a shorter time comparing to the coronavirus. Also, if you show the signs and symptoms of the flu, either flu or the COVID-19, which is, shortness of breath, fatigue, cough, loss of smell or taste. So if you show these signs and symptoms, then it means you have to go and get tested because it shouldn't be COVID and you think that it is flu. This is very important. Some people, they think that, oh, okay, this is a simple flu and I don't need to go and test it for COVID because this is flu. But it is very difficult, as I said, to differentiate between the symptoms of both. So it is advisable to go and get tested in order to not spread the virus to those people with low immunity. For example, people with comorbid diseases and small children whose immunity is very low.
Okay, very good. And Dr. Minja, if you could please translate that in Swahili and just let the audience know like when the best time is to get tested.
Oh, that's asante. So it's translating to Swahili. Alichokuwa anasema Dr. Azeemy ni kwamba ni vigumu sana kutofautisha mafua na hii corona ambayo, COVID-19 ambayo inasababishwa na kirusi cha Omicron. So mara pale ambapo utapata dalili za homa, dalili za kupata mafua na kupata uchovu mwingi, na ndio moja ya dalili ambazo tumekuwa tukiziona na Omicron, ni muhimu sana kwenda kupimwa, na hivyo vipimo sasa hivi vinapatikana kwa wingi, sio lazima kupima kwa PCR, unaweza kutumia hata rapid test ili kujua kwa namna moja au nyingine kama umeathirika na kirusi cha Omicron.
Thank you very much. So I wanted to get right into vaccines, and I just wanted to know, I know that some people are a little bit confused in terms of the dosage between the adult and the kids' vaccines. Are they the same dosages, and how many do they need?
Great questions. Dr. Dawood, you want to take that, or?
You can continue.
Sure. So dose-wise, it's actually half the dose, I believe. And this is speaking of the Pfizer vaccine. So it's actually half the amount that is used for kids 5 to 12 compared to those who are older than 12 years old. However, again, the timing of what's called the primary series is about the same, I think after 21 days. So you take 2 doses, 21 days apart is at least the primary series. And then after that, after 5 months or so, we feel that your immunity starts to become less, and we recommend the booster shot. So this is speaking about the Pfizer series, which is the one that's been approved for kids who are 5 and older. And that seems to be more the preferred vaccine so far. The Moderna is available for kids who are 12 and older, but however, it's not really been approved for kids under 12 years old. So, you know, for school children, pretty much Pfizer is going to be the option most widely available for them.
Okay, I think this is really important because you know, a lot of people are hesitant because they think that it is the same dosage, and they think that kids are a little bit weaker and would not be able to handle the vaccine. And I think that's a really important point. And if I could please ask the both of you to translate that in your language. We can start with Dr. Minja, please, and then next would be Dawood, please.
Yeah, so kwa dozi ya watoto tunatumia chanjo ya Pfizer, na hiyo dozi ya watoto ni nusu ya dozi ambayo inatumika kwa watu wazima na watoto ambao ni miaka 12 na kuendelea. Kwa hiyo tunajaribu kutofautisha dozi wanayopewa watoto wa miaka 5 mpaka 12, and then dozi ambayo wanapewa watoto ambao miaka 12 na kuendelea. Kwa hiyo kama tulivyosema, dozi ya watoto ni nusu ya hiyo, na inatolewa ukishachukua dozi ya kwanza unakaa wiki 3 mpaka kupigwa dozi ya pili. Ni muhimu sana kujua kwamba watoto kama watu wazima kwa kweli wanaweza kuipokea chanjo, ni salama kabisa, haijatoa athari ambazo ni kubwa kuzidi zile ambazo zinaonekana kwenye watu wazima. Kwa hiyo ile hofu kwamba labda watoto wataathirika kuliko watu wazima haijaonekana katika makundi mengi yaliyopata hizi chanjo. Asante. Dawood.
Thank you very much, Dr. Frank. امروزه دوز واکسن کرونا برای اطفال 5 الی 12 ساله، قسمی که دکتر فرانک هم گفتن، نیمی دوز که برای کاهلا داده میشه تعیین شده، اما برای کسایی که سنش از 12 الی 17 سال است بر اونا عین دوز کاهلا داده میشه. باید گفته شود که برای کسایی که سنش 5 سال الی 12 سال و 12 سال الی 17 سال است، فعلا تنها واکسینی را که CDC او را تایید کرده عبارت از واکسن فایزر است. اما برای کسایی که سنش از 17 بالاست، ما شما میفهمیم که یک تعداد واکسین های دیگه از قبیل مدرنا، جانسون جانسون، اونا هم برای بزرگسالا تعیین شدن. یک چیز دیگه را که باید ما برای دوستا عرض بکنم یا برایشان واضح بسازم، برای اطفال پایینتر از 5 سال تا امروز کدام واکسینی تهیه نشده، مد نظر گرفته نشده. دانشمندا در این قسمت کار میکنه و امیدوار هستیم که در آینده نه چندان دور ما و شما شاهد از این باشیم که برای اطفال کوچکتر از 5 سال هم واکسن کرونا را داشته باشیم.
Thank you so much. So for my next question, I wanted to know, in terms of adults and children that have had COVID in the past, are they immune and do they need to get vaccinated?
That's a great question. So the question is whether they're immune. So they have some level of immunity. However, it's not better than vaccine. So if you think about it, I believe the immunity that you get from a previous infection is less than 50%, whereas the immunity that you get from vaccines is almost above 90%. So really what we want to think about vaccines is really a way of boosting your own natural immunity. Whether you've been infected or whether you haven't been infected, it's a way of basically giving your body an advantage over the virus. So it's very important, even if you've been infected, and many people have been infected, to still complete your vaccine series, because that will give you the really maximum protection. As a matter of fact, many feel that if you've been infected and then you get vaccinated, you get what's called super immunity. So if you really want to have a strong body, you should probably have both the vaccine and prior infection, because that really boosts your own immunity.
I agree. I think that's really, really important. And next question would be for Dawood. So going back to, I guess, the hesitance with people getting the boosters, I wanted to know, is getting a booster important, and why do you think it's necessary?
Thank you so much. This is very important for people to understand that getting a booster is very, very important. As Dr. Frank just explained, when you get your first shot and then second shot, the primary data has shown that after a while, the level of the immunity decreases. So in order to boost your immunity, in order to increase the immunity, you need to get the booster shot. And the booster shot is designed for this purpose, to increase the immunity against the virus. As we know, the new variants of the virus may emerge in the future. And the level of antibodies in our body, if it is not in a level to defeat the virus, then the risk of the illness is very high in the person. Taking these notes into consideration, it is very important to get your booster. You can get your booster after 5 months of your second dose, and it will really increase your immunity against the virus.
Okay, can I please get that translated? If both of you could do that, and we can start with Dawood, please.
Sure. بر تمام دوستا باید گفته شود که دوز بوستر یا دوز تقویتی واکسن کرونا خیلی خیلی مهمه باشه، به دلیل از این که وقتی که ما و شما دوز اول و دوز دوم واکسن کرونا را میگیریم، تحقیقات نشان داده که بعد از مدت 5 ماه اونمو سویه انتیبادی هایی که از سبب گرفتن واکسن در وجود ما تولید میشه، مقاومت بدن ما آهسته آهسته پایان میه. از اون لحاظ ما و شما به یک دوز تقویتی که او را در انگلیسی به نام بوستر شات میگه یا بوستر دوز میگه، به یک دوز تقویتی نیاز داریم تا باشه که این دوز تقویتی باعث افزایش انتیبادی ها در وجود ما شود، باعث افزایش مقاومت در وجود ما شود. از اون لحاظ من حیث یک دکتر توصیه ما به تمام دوستایی است که بعد از 5 ماه از دوز دوم واکسنتان شما باید دوز تقویتی یا بوستر شات خود بگیریم.
Thank you Dawood. Kwa hiyo tunazungumzia booster shot ambayo ni dozi ya 3 ambayo utapigwa baada ya kufanya zile dozi 2 za awali. Na kwa nini unatakiwa kufanya booster shot? Ni kwa sababu again tunaongeza kinga ya mwili, na kinga ya mwili itafikia mpaka 90% pale ambapo utakuwa umeshachanja zile chanjo 2 za awali, lakini kadri muda unapokwenda ile kinga ya mwili inazidi kushuka chini. Na kwa hiyo tunasema baada ya miezi 5 ni muhimu kupiga hiyo booster shot ili kurudisha tena ile kinga ya mwili ije juu. Na hiyo ni kwa chanjo ya Pfizer pamoja na chanjo ya Moderna kwa watu wazima. Kwa watoto bado tunatumia Pfizer kwa ajili ya watoto. Kwa hiyo ni tofauti ya wale ambao tunataka kusema kwamba wamemaliza dozi 2 za awali, lakini ili sasa uwe up to date kwamba sasa umeshafikia kwamba bado una ile kinga kamili na miezi 5 imeshapita, ni muhimu kupiga hiyo booster shot kwa wale ambao wamepiga chanjo 3. Kwa hiyo ni vitu vya msingi, na wengi tunaamini kadri muda unapokwenda, huenda labda kila baada ya miezi 12 ama miezi 18 tutakuwa tukipiga booster shot kutegemeana na aina gani ya kirusi kimetanda wakati huo, ili kwenda kujiongezea kinga ya mwili. Lakini ni kitu cha kawaida kwa sababu kama tunavyozungumzia kirusi cha influenza ni kitu ambacho kila mwaka wakati wa winter, wakati wa baridi tunapiga hiyo chanjo ya flu. Kwa hiyo nadhani corona huenda tukaelekea huko kwamba tunahitaji kupiga chanjo ya booster mara moja kwa mwaka. Asante.
Very good. My next question was this. I think sometimes people get confused. If you test positive for COVID and they want to get vaccinated, is there a time period that they should wait to get the vaccine? Or I had a friend that recently told me that they were told that their son needed to wait 4 months. And I didn't think that was accurate. So if you could clarify that for us, please, and we can start with you, Dr. Minja.
Yeah, so I'm not sure what the most recent guidance is on that, to be honest, Swad. Initially, I think you used to wait at least, I think it was like 90 days. You had to wait from when you tested positive before you'll be eligible for a dose of the vaccine. I don't know now that we're requiring boosters, whether it's still like 90 days. I would think that it's less. I just don't know the exact time that we're asking people to wait. Dawood, maybe you have that information?
I was looking to CDC guidelines about, after when you are tested positive for COVID-19 virus, then how long should you wait to get your booster shot or your COVID vaccine? So the latest guidelines say if you don't have signs and symptoms of COVID, when you first test positive, and after a while, when you don't have the signs and symptoms of COVID, then you're eligible to get your booster shot or your first or second COVID vaccine dose.
Okay. And then another really sort of hot topic is, does the vaccine cause infertility in women? And I've noticed that a lot of young women are very hesitant about getting the vaccine because, they've said, we want to have kids in the future and all of that. So could you please answer that, starting with Dawood? Does the vaccine cause infertility? And if we can get that translated, because I feel like that's a very important.
Yeah, that's very important question that we should be answering in our local languages as well, because to make it very clear for the people, this important message. As a physician, I would say that COVID-19 vaccine does not cause infertility. The data that we have so far, there is no scientific evidence that COVID-19 vaccine is causing infertility. When a vaccine is developed or when a drug is developed in medical field, it goes through a lot of scientific process. And the scientists, they are checking the vaccine or the drug in so many steps to make sure that the benefits of the using drug is very high than the risks. So this applies for the COVID-19 vaccine. When COVID-19 vaccine was developed by some pharmaceutical companies, this important message was considered. So this vaccine has gone, under several trials and has been checked under several conditions. For example, if a person is pregnant, if a person has comorbid diseases, if a person has heart diseases, or if someone has diabetes. So in all these scenarios, the vaccine should be beneficial to the person and should not harm the person in any means. I know in some conservative communities, or some people may think that the vaccine is causing infertility. That is the rumors that you are hearing from the people, but that rumor doesn't have a scientific root. So again, as a medical professional, I would say that the vaccines do not cause infertility at all, and you have to get the vaccine without worrying at all that it will cause infertility.
And yes, sorry, Dr. Frank, go ahead.
Asante sana Dawood for that answer. So just to state it in English, that again, the COVID vaccine does not cause any infertility and does not prevent women from having babies. Actually, I would say the COVID vaccine protects you from getting COVID, and that actually serves two purposes. For the women, if you're pregnant, it makes your pregnancy safer. And for men, it actually makes sure that you don't get severe COVID, which can actually affect male fertility. So actually, if you're worried about having babies, the COVID vaccine is actually one of the things you absolutely should have, because it boosts your immunity and it prevents the possibility of you having a severe COVID. So I think it's actually it actually boosts fertility. It actually has the opposite effect. It boosts fertility, and also it actually prevents severe complications of pregnancy once you have the vaccine. So to state this in Swahili, again, kwa wale ambao wanaogopa kwamba chanjo ya corona huenda ikasababisha shida katika kupata ujauzito, hiyo sio kweli. Wanawake wengi sana ambao wamepata ujauzito baada ya kupata chanjo, wanawake wengi sana pamoja na kuwa wajawazito wamepigwa chanjo na wapata watoto wao salama. Na kitu ambacho tunajaribu kusema ni kwamba kwa wale ambao wanatarajia kupata watoto ama wanatarajia kupata ujauzito, chanjo ya corona ni kitu cha msingi sana, kwa sababu mama wajawazito wakipata corona kali kwamba huwa wanaathirika zaidi kuliko wamama wasiokuwa wajawazito. Kwa hiyo na kwa wanaume ambao wanakuwa wanahofia kwamba labda chanjo inaweza kupunguza nguvu zao za kiume, wale ambao wakipata corona kali kwa kiasi kikubwa actually inaathiri nguvu za kiume. Kwa hiyo kama wewe unahofia nguvu za kiume, unahofia chochote kuhusu corona ama chanjo kumbe kitu cha msingi ambacho kitasaidia kukinga nguvu zako za kiume, tusaidia uwezekano wa kupata ujauzito, na tusaidia wewe kuweza kuwa na ujauzito na kumzaa yule mtoto salama.
Okay, perfect. And Dawood, if you could translate that please for us.
Sure. خدمت دوستای عزیز باید عرض شود اگر شما بخصوص خانما نگرانی داشته باشه که گرفتن واکسن کرونا باعث اقامت میشه، من من حیث یک پرسنل طبی ای اداره کاملا رد میکنم، به خاطر ای که وقتی که یک واکسن انکشاف داده میشه و طی چندین مراحل آزمایشی میره و بالاخره توسط دانشمندا تمام عوارض جانبی از او مد نظر گرفته شده، او عرضه میشه به جامعه. از اون لحاظ واکسین هایی که تهیه میشه تمام مسائل در او مد نظر گرفته میشه، مسئله اقامت و اگر کسی که دارای امراض دیگه مثل امراض قلبی باشه یا شکر داشته باشه یا کدام مرض مزمن دیگه داشته باشه، دانشمندا وقتی که واکسن یا هر دوای دیگر انکشاف میده تمام عوارض جانبی از او را مد نظر میگیره و مطمئن میسازه که فواید از امو دوا یا از امو واکسن از اضرارش کده بیشتر باشه. یک تعداد مردم به این عقیده است که شاید امی واکسن باعث اقامت شود. من این مفکوره را کاملا رد میکنم، به هیچ وجه واکسن باعث اقامت نمیشه. واکسن برعکس شما را از مصاب شدن به ویروس کرونا شما را جلوگیری میکنه و باعث از این میشه که خودتان و طفلتان که در بطنتان است و محفوظ و صحت و سالم باشه.
Thank you so much. And the next question I was going to ask, I think, Dawood, you touched on this just a little bit, but we wanted to emphasize, at one of the events that we were at, I think there were some people that were concerned if they had a chronic condition, if the vaccine was safe for them. So if we could please talk about that and just talk about the benefits of getting the vaccine for people that have chronic diseases.
As I mentioned earlier, when a vaccine is developed, so all the different conditions will be considered. So some people with chronic diseases or comorbid diseases or some other health conditions, they might be worrying, if I get the vaccine, will it worsen my condition, or will it have a bad impact or a negative impact to me? No, I would say no. The vaccines is not having a negative impact, or the vaccine is not worsening your health condition. But if you're not vaccinated and if you're infected with coronavirus, then the chances of worsening your health condition is a lot. The vaccine is designed to protect you against the virus, and this will help you, to be healthy. So I would suggest for all people who have chronic conditions to get their vaccine series as well as their booster shots.
Okay. And Dr. Minja, could you translate that for us, please?
Yes. So kama endapo una magonjwa ya sugu, mathalan kisukari, mathalan shinikizo la damu, mathalan saratani, kwa mfano, kwa maana ya cancer, hypertension, na diabetes, hayo magonjwa kwa kiasi kikubwa yanapunguza kinga yako ya mwili. Kwa hiyo kwa watu kama hao, actually ndio mahususi kabisa wanahitaji kupata chanjo za corona. Kufikia kwa wale ambao labda pia wanatumia dawa za kansa na dawa za saratani, wanashauriwa wapate dozi 3 katika awamu za awali za kupata chanjo hii ya corona. Kwa hiyo ningesema ni kitu cha msingi sana tuelewe kwamba chanjo, kitu kikubwa ambacho kinafanya ni kupunguza uwezekano wa wewe kupata corona kali, kwa maana ya corona ambayo itakupelekea kwenda hospitali. Kwa hiyo kwa wengi ambao wanaishia hospitali, wengi wao huwa wanakuwa na magonjwa ya ziada, kwa maana ya kisukari, kwa maana ya shinikizo la damu, kwa maana ya saratani, pamoja na uzito uliopitiliza kiasi. Kwa hiyo kama wewe uko katika makundi hayo, kwa hakika kabisa chanjo kwa wewe ni kitu cha msingi sana, na chanjo ndio itakupa ile kinga ya zaidi ya kupelekea kutokupata hiyo corona kali. Asante.
Thank you so much. And then my next question is, we're going to be focusing a little bit on kids. And I wanted to find out, what advice can you give people who feel that children are resilient and don't think COVID-19 can affect them? Any one of you can answer that.
Yeah, it's a tricky question, but it is true that children, for the most part, have not been getting the severe form of COVID. However, very few children get what we call MIS-C, which is a multi-inflammatory system disorder seen in children. So just to say that is a very severe form of inflammation. That's a few kids, especially those who have other conditions, can get that particular disease, that particular form of COVID-19. So I would say most kids do not get affected, but we do have a few children who get very, very, very sick. And again, the vaccine has been shown to be actually protective against that. So why take a chance with your child for them to have this chance of getting this really, really severe form of COVID, when actually you can protect them with a very safe tool that's invisible, and that's called the vaccine. So as we move towards this new era where we're not going to be having masks going to be optional, really the only way to protect yourself actually is going to be vaccinations. I actually feel that as we're moving away from masks, where it's a visible form of protection, actually having a vaccine, which is an invisible form of protection, is going to be even more important. So the children who are fully vaccinated, yeah, they can roam around without a mask. But if your child is roaming around with them and your child doesn't have vaccine, they're sort of at a disadvantage. So that's another way to think about it, to just give your own children an advantage as they move into the public space.
That's really important. All right, Dawood, if you want to translate that, and then I'm going to come back to Dr. Minja to translate what he said.
Sure. یک تعداد از مردم به این عقیده است میگه که اطفال خردسال کرونا نمیگیرن. این یک باور نادرست است. مرض کرونا یا همین کرونا ویروس، چی یک کسی طفل باشه، چی بزرگسال باشه، چی میان سال باشه، چی خانم باشه، چی مرد باشه، هر کی که باشه مرض کرونا او را مصاب میسازه. و گرفتن واکسین برای اطفال خیلی مهم است، به دلیلی که اطفال مثل که بزرگان در مقابل مرض واکسین محافظه میکنه، اطفال هم محافظه میکنه. درست است که ما شما شکل شدید مرض در اطفال ندیدیم، اما این به این معنی نیست که در حقیقت کرونا هیچ اطفال نمیگیره، اطفال هیچ مصاب نمیسازه، اطفال مصاب میسازه. بعضی واقعات بسیار شدیدش هم در اطفال دیده شده که باعث بستری شدن اطفال در شفاخانه شده و حتی باعث مرگ و میر اطفال شده. تا فعلا قسمی که در ابتدا ما گفتم، ما و شما واکسین برای کسایی که سنش از 5 سال به بالاست در کشور وجود داره. ما میتونیم که از این واکسین ها استفاده کنه، اطفال خود در مقابل مرض محافظه بکنیم. علل خصوص ما و شما در این اواخر در جریان هستیم که پوشیدن ماسک در مکاتب یک چیز انتخابی شده و اگر اطفال ما در مقابل مرض توسط واکسین محافظه نشده باشه، در این صورت بسیار مشکل است که بدون ماسک ما بفهمیم که اطفال ما در حقیقت مرض نمیگیره. بنابراین بهترین چیزی که اطفال ما را محافظه میکنه عبارت از واکسین است و واکسین اطفال خود ما باید تطبیق بکنیم.
Yeah, thank you Dawood for that. Tulikuwa tunazungumzia chanjo kwa watoto. Kwa nini chanjo kwa watoto ni muhimu? Kwa tukasema sasa hivi tunavyoelekea kwenye kipindi ambacho wengi hawatakuwa wakivaa barakoa, kwamba barakoa ni hiari yako, ukitaka kuvaa barakoa sawa, usipotaka kuvaa barakoa. Ni muhimu sana kwamba wale watoto ambao watakuwa wamechanjwa watakuwa wamepata kinga ya ziada. Kwa hiyo ni kinga ambayo haionekani kwa wazi. Watu wakivaa barakoa, kila mtu anajua kwamba mtu amevaa barakoa. Lakini tunapoenda katika kipindi ambacho wengi watakuwa hawajavaa barakoa, kwa kweli wale watoto ambao hawatakuwa hawajachanjwa, kwa kweli watakuwa wako katika disadvantage, kwamba hawajapewa ile kinga ya ziada. Na cha kumalizia, kwa nini watoto wanatakiwa wapate hii chanjo? Kwa sababu kuna watoto wachache ambao wanapata corona kali sana, ambayo inaenda kwa jina la MIS-C, kwamba ni ile mwili wako unakuwa umepitiliza kwa maana ya kuwa na inflammation, na hiyo inawapelekea watoto kuishia ICU. Kwa hiyo ni kitu cha msingi sana kama tutaweza kuwapa watoto wetu hiyo kinga ya ziada. Tujue kwamba makundi mengine yako mbele sana katika kuwapa watoto wao kinga ya ziada, na makundi haya wako mbele sana katika kuwaambia watoto wao hawana haja ya kuvaa barakoa. Kwa hiyo unaweza kaweka watoto wako wanajichanganya, unadhania wote wako sawa, lakini wenzako watoto wao wote wamepata chanjo zao 3 kama inavyostahiki, na wewe watoto wako hawajapata chanjo yoyote, kwa hiyo wanakuwa hawajapata ile kinga ya ziada. Asante.
Thank you so much. Could you tell us, do kids also need boosters just like the adults do?
Dawood?
Yes. So far we have COVID-19 vaccines available for the kids above age 5. We don't have vaccines for the kids below the age 5. So for the kids between the age of 5 to 12, those 2 primary doses are recommended. We don't have a booster dose for this age range, but for the kids above the age of 12 to 17, we have booster doses for this age range as we have for adults.
Okay, thank you so much. Another question that we get asked a lot in the community is, if my child doesn't attend school and they're not around people a lot, why should I get them vaccinated? And if we can start with you, Dr. Minja, if you could answer that.
Yeah, it's a good question. However, with children, really, they may not be attending school, but most children are going to be in public spaces one way or the other, whether it's playgrounds, whether it's religious centers, whether it's community centers, whether it's family gatherings. So just because they're not going to school doesn't mean that the children are not mixing. They're going to go to malls, they're going to go, and especially as the weather gets better, kids are going to be kids, and kids are going to want to mix with other children. So I think for those reasons, both to protect themselves, and also we say to protect other people in their community, especially those who may be immunocompromised or those who are the elderly in their family. So I think school, yes, is a major exposure, but that is not the only exposure that we're protecting the children against by getting the vaccines.
Yeah, and I think that's really important too, because kids really don't have any boundaries. You know, you want to be able to tell them, well, you know, stay away from this person and don't get too close. But at the end of the day, you'll find them taking off their masks and hugging each other and doing all of these things, sometimes even sharing food, which I think is it's really important to sort of emphasize the importance of vaccine on children. And if I can get that translated, please, we can start with you, Dawood, please, and then we'll get back to Dr. Minja.
Yeah, sure. یک چیزی که برای دوستای عزیز باید واضح ساخته شود، یک تعداد مردم به این عقیده است میگه که طفل ما معمولا در خانه است و مکتب نمیره، چرا ما برای طفل خود واکسن کرونا را بگیرم. درست است، اگر اطفال مکتب نمیره به این معنی نیست که اطفال هیچ از خانه نمیبره. ما شما میفهمیم که کنترل اطفال یا قید نگه داشتن اطفال در خانه یک کار بسیار مشکل است. اگر اطفال مکتب نمیره به این معنی نیست که اطفال بیرون نمیره. اطفال در دیگه برنامه‌ای که بیرون از خانه است، مثلا شاید اطفال با اطفال دیگه ساتری بکنه، اطفال شاید دکان‌ها بره، اطفال شاید مساجد یا در اجتماعات دیگه بره. بنان اگر در این جای میره، این هم مثل عزیز که در مکتب میره و با یک تعداد کثیری از مردم اینا مواجه میشن. اگر در بین اونا کسی منتن باشه و ویروس به طفل شما انتقال بده، طفل مصاب میشه. یک چیز دیگر هم باید ما متوجه باشیم، اگر احیانا شما اطفالتان حتی از خانه بیرون نمی‌جازنتین، خود شما بیرون میرین، دیگه اعضای خانواده بیرون میره. وقتی که دیگه اعضای خانواده بیرون رفت، امکان داره امو عضو خانواده ویروس گرفته در خانه بیاره. از اون طریق هم طفلتان میتونه ویروس بگیره، منتن شود. از اون لحاظ توصیه ما ایسته که اطفالتان اگر شما میخواین در مقابل از این مرض مهلک محافظه بکنین، باید اطفالتان واکسین شود تا اینکه خودتان و اطفالتان صحتمند باشه.
Thank you Dawood. So tunazungumzia kwa nini watoto wapate chanjo hata kama labda hawaendi shule, na kitu cha msingi ni kwamba hatuwezi kuzuia watoto kuchanganyika na watoto wengine. Kwa hiyo hata kama hawaendi shule, huenda wanakutana katika makanisa, katika misikiti, katika sehemu zote za kijamii, wanaenda kwenye harusi, wanakwenda kucheza pamoja nje kwenye parks na kadhalika. Kwa hiyo watoto kwa kweli huwezi kuwazuia kuchanganyika na watoto wengine, na pia huwezi kuwazuia katika kujumuika katika jamii kwa ujumla. Huenda katika watu katika familia zao kuna watu ambao ni wazee, watu ambao labda wana magonjwa ya sugu ambayo yanaweka katika athari kubwa zaidi ya kupata corona. Kwa hiyo hii ni moja ya njia ya kuwakinga wao, lakini pia kinga watu ambao wako katika jamii. Kwa hiyo ni kitu cha msingi sana kweli. Nadhani ni kuangalia kwamba hii ni chanjo, ni kinga ambayo haitaonekana, na hatutaja kujua nani yuko kwenye playground amechanjwa, nani yuko kwenye playground hajachanjwa. Kutakuwa na watu wenye alama za usoni kwamba huyu amechanjwa, huyu hajachanjwa. Kwa hiyo huyu unaweza kucheza naye, huyu siwezi kucheza naye. Kwa hiyo ni kitu cha msingi sana kujaribu kuwapa kinga yote ambayo tutaweza kuwapa watoto wetu. Asante.
Thank you so much. I also wanted to talk about a little bit about masks and testing. Now, in terms of the masks, what are the best masks to wear to ensure maximum protection? And if we can start with you, Dawood, please.
Mm-hmm. Thank you very much, Swat. This is also a very important topic. So with the Omicron and Delta variant, we knew that the transmissibility of the virus was very high, which means the virus will be easily transmitted from person to person. And the new studies have shown that the ordinary mask that people have, cloth masks, they're not effective in preventing the spread of the virus. That's why the new guidelines are suggesting we should be using medically approved masks, which means we have to use surgical mask, we have to use K95 and N95 masks. The N95 mask is a ideal mask which prevents which restricts the spread of the virus in a very higher percentage. But we understand wearing an N95 mask is very difficult for some people, but K95 masks and other medically approved masks are available in the market, and we should be using them instead of cloth masks or instead of using our scarf or something else.
So I absolutely agree. And I think that is an important point. If we could please get both that translated as well.
Sure. خدمت دوستای عزیز باید عرض شود که استفاده از ماسک یک موضوع بسیار خیلی مهم است. ما شما با نوع جهش یافته دلتا و نوع جهش یافته اومیکرون دیدیم که ویروس چقدر به سادگی ای میتونه انتشار بکنه از یک شخص به دیگر شخص. تحقیقات اخیر نشان داده که استفاده ماسک‌های تکه‌ای و استفاده چادر یا استفاده بعضی ماسکایی که توسط دکترها تایید نشده، ماسکایی که از طرف سازمان‌های صحی تایید نشده، استفاده اونا را توصیه نمیکنه. استفاده از ماسک‌های طبی، مثلا ماسک‌های جراحی، ماسک‌های مثل K95 و N95 اینا میتونه که شما را محفوظ نگاه بکنه و از گرفتن ویروس شما در امان باشین. توصیه ما ایسته که به عوض استفاده از ماسک‌های تکه‌ای شما باید از ماسک‌های طبی مثل ماسک K95 یا ماسک‌های جراحی استفاده بکنید.
Thank you Dawood for that. Kwa hiyo tunazungumzia aina za barakoa ambazo zinaweza kuwa na kiasi kikubwa sana cha kupunguza maambukizi ya corona. Kama wengi ambao mnafahamu, kuna hizo barakoa za KN95 ama N95 ambazo ndio zina ubora kabisa wa kuzuia maambukizi ya haya ya corona. Chini ya hapo kuna hizo ambazo zinaitwa surgical mask ambazo ni bora kuliko barakoa za kitambaa. Kwa hiyo hizo pia ni kitu cha kuzingatia. Lakini pamoja na hayo, jana tu tumeona CDC wamebadilisha ushauri wao kuhusu barakoa. Kwa hiyo pia itategemea na jinsi corona ilivyo katika sehemu ambayo unaishi, na hivyo katika county ambayo tupo, hii county ya DeKalb na county ya Fulton, kwa sasa hivi wanasema kwamba kuna maambukizi hapo chini. Kwa hiyo itakuwa ni hiari kwa watu kuvaa barakoa. Kwa hiyo ni katika jaribu kubadilika na wakati, habari zinaenda zikibadilika, huenda tukapata kirusi kingine cha aina nyingine, tukalazimika tena kuvaa barakoa. Na kipindi hicho sasa ni muhimu kujua barakoa gani ndio za salama. Kwa hiyo katika kipindi hicho kuvaa surgical mask itakuwa cha msingi sana, na kujaribu kujikinga zaidi, barakoa za N95 ama za KN95 zitakuwa ndio kitu cha msingi sana. Asante.
Thank you so much. The next thing I wanted to talk about was testing. So we realized with our community ambassadors being out and about and raising awareness is that a lot of people were not aware that you could get free test kits. So I really wanted to kind of talk a little bit about that and just inform everyone that you can get at least 4 free test kits that can be sent to your house. And I want to go ahead and just share a link so that everyone is able to see it. We do have a QR code for this, and we will be putting this up in our website as well. And with this information, you can just go on the website. All you need to do is just put your name in and your address, and that should be mailed out to you. So if you ever suspect that you have COVID-19 and you don't have transportation or ways of getting to a testing site, then you can just get tested at home. The instructions are very clear. And yeah, so I just really wanted to share that with you guys. And then my last thing is, I know it's almost, we have like 10 more minutes. So I quickly would just want to say, one thing I really also wanted to ask you is to just get an idea of the current situation with COVID. I think that, we've been in this pandemic for a while now, and people are somehow forgetting that COVID still exists. And, they're forgetting about social distancing or wearing masks. And, a lot of people don't even watch the news to see what the situation is. Could you please tell us, both Dawood and Minja, like what is the current situation right now with COVID and the rate at which people are being affected?
Dr. Frank?
Yeah, so I was, as I was sharing, and maybe we can show them on that CDC website, just yesterday, they changed the guidance around like the need to wear a mask, and that will depend on the level of transmission in your community, meaning at the county level. So for example, the counties of Fulton and the counties of DeKalb, where Clarkston is, actually the transmissibility is actually low. So that's actually very, very good in this period. But as we know, the COVID and coronavirus infection goes in waves. And so really we're just coming out of the Omicron wave, so to speak. So the hospitalization is down, the community transmission is down. So I think now is actually the best time to double up our efforts in getting people vaccinated in preparation for the next surge. We don't know when the next surge will be coming, but again, as we know, the virus is changing, the virus is mutating. So chances are we will have another surge. It may not be as big as the Omicron surge, but nevertheless, the vaccination is going to be the best way for us to protect for that foreseeable future.
Great. Dawood, would you like to add to that, or?
I would add a few more sentences. This pandemic is not over. We are still in the middle of the pandemic. And although recently the number of hospitalization and the number of infection rate is low, both in the United States and in other parts of the world. And as Dr. Frank pointed out, there are chances of new variants, the virus, as long as the people are not vaccinated, they will be infected and the virus will mutate in them and new variants will come out. And this will put everybody into danger of getting the virus. So we are still in the middle of this pandemic, and the only way to end this pandemic is to get vaccinated. So therefore, our request humble to all of our participants and others who will be viewing us on our social media is to get vaccinated and encourage your family members and community members to get their vaccines, and let's put together an endpoint to this ongoing pandemic.
I agree. Well said. Thank you so much. So lastly, we just want to open the session to everyone else. If anyone has any questions or would like to speak up, now is your time. This is a no judgment zone. You can ask us any questions that you would like. I had a few people raise their hands. So if you can come forward and ask any question that you would like for the doctors to answer, I would really appreciate it. Don't be shy. Anyone can ask.
Hi. Good evening, everyone. Hello.
Yes, hi, how are you?
Good, I'm Furaha, Jacqueline. I'm sorry for joining late. My question is about sample collection at home. I got the kit, but I'm really challenged about how to collect the sample. I know when you go to the hospitals, they have no masks. They'll push it in your nostril and it's really painful. I have the kits, but I don't know if it will be easy for me to collect the sample from my son using yeah, that's my question. What should we do? Because doing it at home, we might end up having like false negative. Thank you.
Sorry about that. Dr. Minja, would you like to go ahead and answer that question for us, please?
Yeah, that's a great question, Jacqueline. Yes, it's a challenge, especially if a parent is trying to administer the test. for their child. I know that's going to be challenging in sort of collecting the sample, but I think it's a balance between the convenience of doing this at home versus having to go into a center. So I think if you're worried about getting a false negative result, then you're probably better to go and get tested at a facility. But really the idea here was to give people the convenience and also them not having to wait, because sometimes even when you go to the COVID testing center, you have to make an appointment. So I think it's a bit of a balance, but I think the concern you raise is very valid. It is not easy to collect a sample in a young child or even collecting a sample in yourself. But some people in America like convenience and like choice. And so the government, thankfully, is giving people that option. But still, there are places you can go and get tested by professionals if that is your preference and you want to really be sure that you are not infected with COVID. Thank you.
Yes, I agree. And usually with pediatricians, they would do the mouth swab as opposed to doing the nose, which a lot of kids are very sensitive about. So I think that would be much easier. But, you know, you can use this for yourself, you know, for other family members or adults if you find it challenging. But it's really just it's a great thing to have at home and to be able to get, you know, test yourself when you are unable to physically go to a location to do that. Anybody else would like to ask any other questions? Okay, I see, let me see, I see one person actually had raised their hands. Yes.
iPhone is on mute.
Okay, iPhone is on mute, so I'm trying to...
Yeah, probably Dr. Frank, if you talk in your own language, if they may understand your language, to unmute.
Oh, iPhone, are you trying to unmute? Unajaribu ku unmute? It's mkono wa chini kushoto, near the microphone, you can unmute. iPhone, you can unmute, bonyeza karibu na kitufe cha microphone. Yeah, uko. Yeah, now you're live. Karibu.
Habari ya saizi?
Nzuri kabisa, karibu sana.
Ndio, kuna wazazi niliko nao hapa, ila wengine wameshaondoka.
Ndio.
Sasa kuna swali ambazo wameacha ili niulize, afu ndo mtawaambia mtakavyo nijibu.
Sawa, karibu sana.
Swali la kwanza wamesema kwamba au wanauliza kwamba kuna shindano 3, ya kwanza, ya pili na ile ya 3 ni yani kuweka nguvu kwa zile 2 ambazo zimeshapigwa. Je, hakutakuwa nyingine ya 4? Maana hiyo ya 3 inaweza kuisha nguvu, haitakaa milele. Je, hamtaleta nyingine ya 4?
Ndio.
Na
sawa, tujibu ama tusubiri swali jingine?
Jibu kwanza hiyo.
Okay, can we so fortunately I understood what he said because I speak a little bit of Swahili, but if we can please be able to translate that very quickly in English, just so everyone understands what he's asking.
Yeah. So the question is on, they understand that there's 3 vaccines where you get the first 2 primary shots, and then there's a booster shot. So the question is there going to be a 4th booster shot, so to speak? And they sort of want to be reassured probably that they would not be. So what I can say is we don't know for sure whether there will be a 4th booster shot. At the moment, there isn't not, but I think many in the medical profession feel that likely this will be a seasonal event, and at least once a year or once every year and a half, we will get a booster shot. Kwa hiyo kwa Kiswahili ni kwamba hatujui kama tutahitaji kupigwa chanjo ya 4. Lakini kadri tunavyoona kwa kulinganisha na kirusi cha influenza, kirusi cha flu, kila mwaka tunapiga chanjo ya kirusi cha flu. Kwa hiyo hata corona nadhani baada ya muda tutatakiwa tupige tena chanjo nyingine kwa sababu kinga inaenda ikishuka. Kwa hiyo kama tutaendelea kupata hizo infection, inawezekana kwamba corona ikaisha mwaka huu, kwa hiyo tusisikie tena corona, kwa hiyo kutakuwa hakuna haja ya kupiga booster. Lakini kama corona ikiendelea kurudi, nadhani tutahitaji kupiga booster tena.
Okay, swali nyingine ya pili, hii imeulizwa sana mtaani.
Sawa.
Je, kwa nini watu ambao wameshapigwa shindano tena wanavaa mask au barakoa? Kwa nini wanaendelea kuvaa barakoa?
Kwa nini wanaendelea kuvaa barakoa?
Na wameshapigwa hizi shindano.
Sawa kabisa. So hiyo ilikuwa wakati ambapo tulikuwa na hichi kirusi cha Omicron kinaambukiza kwa haraka sana. Kwa hiyo ukumbuke kwamba tunapokuwa kwenye hichi kitu tunaita surge, kwamba wimbi la maambukizi, tukiwa katika ile wimbi la maambukizi ni muhimu sana kujikinga kwa namna yoyote, kwa maana ya chanjo pamoja na barakoa. Lakini tukiondoka kwenye wimbi, yani mathalan jana Ijumaa CDC wamesema kwamba kama hatupo kwenye wimbi, kwa maana kwenye county yako, county ya DeKalb, county ya Fulton, hauko kwenye wimbi, ni hiari kuvaa barakoa. Kwa hiyo nadhani watu watapata nafuu, hasa kama umechanja na uko katika hizi county ambazo hazina maambukizi, wimbi la maambukizi, unaweza kupunguza kuvaa barakoa. If I may, Swad, maybe just to screen share briefly the map on CDC, to just show that again, maybe for other listeners, because they may not have seen this new advisory, which I think is going to get a lot of press.
Okay, perfect. Let me, do you have the screen already pulled up? I can make you.
Yeah, if you just make me co-host, then I can.
Perfect. Okay, I will do that right now. Okay, you can go right ahead.
Let me try. Okay, excellent. All right. So what I'm trying to show here, hopefully it's showing on my screen.
It is.
So this is on the CDC website, and it's showing COVID-19 community levels by county. Kwamba wameenda kwenye kila county katika Marekani, right? Wakakupa rangi tatu. Kwamba kuna rangi ya kijani ni low, yellow is medium, and then this sort of like orange is high. So when you come to Georgia, so this is state of Georgia. So we're in the state of Georgia now, okay? You can see some counties have high, some counties have low. If your county is low, you don't have to wear a mask. So we are here in, we're in DeKalb County. So in DeKalb County, the community level transmission is low. So for these, they're saying that mask is going to be optional. And then over here, it's sort of like, medium. So what they're saying with CDC, you have to know the level of transmission in your own county. So meaning if I go to a county down here, let's say all the way down here in this county where it's high, in that county, it's important to wear a mask because you have a high level of transmission. So this is the latest data that came out 2 days ago, February 24. And I think it's important that we are aware of the community transmission, because that is going to change whether we have to wear a mask or we don't have to wear a mask.
Absolutely, I completely agree with you. Thank you so much, Dr. Minja. And it looks like we're actually past 3 minutes. I want to be respectful of everyone's time. I didn't know if anyone else had another question to ask.
Yeah.
Is everyone? Did you have any other additional questions? Or
sorry, iPhone, did you have another question or Memaliza?
There is another question here.
Okay. Last question for
last question, yes. Thank you so much. I appreciate that.
Nauliza hivi.
Ndio.
Katika maisha ya mwanadamu, kifo hakipo au kipo?
Kipo.
Kipo?
Kipo,
Na anayezuia kifo ni nani?
Mungu.
Sasa barakoa inaweza kuzuia kifo.
Twende taratibu.
Sasa nauliza taratibu.
Nauliza
barakoa inaweza kuzuia kifo, ndio swali langu la kwanza.
Sawa. Okay. So I'm gonna translate it for the audience and then so basically they're asking, okay, you know, are we all going to die? The question is,
okay, I'm so sorry. Hold on 1 second for me. iPhone, if you could please mute yourself so we can hear Dr. Minja. I appreciate it.
Yeah, so they're asking, you know, we are all going to die at some point, and the answer is yes. And then who prevents death? Obviously, only the Lord knows when you're going to die. So the question is, do we think a mask can prevent death? And this is an important question, especially when people are asking, you know, if I get vaccinated, am I not going to die? And that's a very, very important question. So I think the way we want to think about this is there are many ways in which we protect ourselves, okay? There are many ways in which we protect ourselves. For example, I will just tell you, let's forget about the vaccine for a second. Let's go about a car, okay? Do you think wearing a seatbelt prevents death? Okay, so if you get in an accident and you're wearing a seatbelt, does that guarantee that you're not going to die? No, it does not guarantee. But we know that people who get in an accident and you have a seatbelt, you have a much better chance of surviving compared to somebody who's in a car without a seatbelt, okay? Same thing, when you come about protecting your house, right? Do you only use the door? Do you only use an alarm? Do you also use the police? So we're talking about layers of protection, okay? So it's an important concept that we don't use one thing to protect you against everything. And we always have layers and layers of protection. So when we come to the COVID vaccine and the COVID disease, the vaccine is one layer. The mask is another layer. Social distancing is another layer. Checking the data on the CDC website is another layer. Being aware of your surroundings is another layer. So it's all about layers. So, and I think it's very important that, yes, we cannot prevent death completely, but also the same God, the same person, the same force that we believe in has given us the knowledge, has given the scientists the knowledge to give us tools to protect ourselves. And so it's up to us to accept those tools and to use them. But no, I can't say here a vaccine is going to guarantee 100% you're not going to get infected, 100% you're not going to die. I can't say if you wear a mask, 100% you're not getting infected, 100% you're not going to die. But again, it's a concept of layers of protection. And so we are giving ourselves the best chance for a healthy life. And that's all we're doing. So what I'm doing now, I don't think me and Dawood have convinced 100% of people here. But if we've convinced 2, that is an extra layer of protection in our community. If we convince 3, that's an extra layer of protection. And Suad and her team are doing more and more to reach out to the community. So it's about layers, my friend. No one thing can protect you. We could have an earthquake on this phone call and all of us die. And so it's just, it's a matter of layers of protection. And maybe Dawood, you have another way of answering that, because I think that's a very important angle. And I think especially for people who have a strong religious faith, this is another angle in which they say, you know, prayer, if I'm praying, then I should be sort of protected, and that's enough. And I think again, prayer is an important part, but it shouldn't be the only thing you use to protect yourself. Over to you, Dawood.
Thank you very much, Dr. Frank. You have pointed out very important points. Yeah, I was facing the same kind of questions when I was back in my home country. Some people were telling me that this invisible thing, is it going to kill me? I believe in God, so the death and, you know, the life comes from the God. So why I should worry about something that I don't see? We appreciate everyone's belief, but in the meantime, we also believe in science, because you know, science is telling us that this thing is harmful for you, and that has been proved. Likewise, in religion, there are some things that the religion is prohibiting you. For example, in some religion, one thing is prohibited, and the logic behind that is to protect you, as you said. In some religions, you're not allowed to eat certain foods. You're not allowed to drink certain drinks. You're not allowed to use drugs. So that's, again, protection. So now with the coronavirus, If you have a chance to be protected against a disease and be healthy, why you shouldn't be? Happiness is a gift from the Lord or from the God. We are here to enjoy the life that we are living. We are here to be happy. And instead of being infected and being unhappy, why shouldn't we be happy? So this is how I will interpret this.
All right. Well, thank you so much to everyone. It is 4:10. I really appreciate your time. I want to thank the panelists and all of the participants for being here today. We will do more of these COVID-19 adult and children vaccine webinars. And please stay tuned. We will be posting the flyers very soon. And, we're hoping to do this on a monthly basis. So stay tuned. Thank you so much, Dr. Minja and Dawood as well for your time. And I just want to say thank you to everyone for being here on such a beautiful day. It's time for everyone to go out and have fun and enjoy the rest of your weekend.
Thank you so much.
Thank you so much. Thank you very much.
Thank you very much, Swad and Dr. Frank.
Thank you.
Asante sana isi. Oh my goodness.
Sana nashukuru.
Sana sana.
Asante tunashukuru kwa
Thank
kufundisha.
you.
Asante, asanteni sana.
Asante.